the end of the morning, sorry, we will see the superficial planes of the face. So I will take a vertical landmark first, and a horizontal one. If necessary, I can edit a PDF file of this course of the drawing, so you're not obliged to take the money. And we will see a lateral aspect of this superficial plane. So I will show you those on the face. First of all, the mastoid process. Here the temporomandibular joint. Dorsally the occipital bone, and ventrally the nasal fossa and the nasal bone. Here is the orbit, and here the temporal fossa. You will find here the vertebral column, and here the mandible with the mandible and the body of the mandible. Here the coronary process you recognize, and let's finish the mandible. So the maxilla, the teeth, and here the temporal bone with the styloid process. On this, the subject now is the superficial plane, so we will represent the superficial planes. And I'm going to show you some muscular landmarks. To begin, the sternocleidomastoid muscle that we represent this way. We will cut it here, and just show the direction of the fibers, and the masseter muscle here. Between these two muscles there is a gland, as you know, which is a parotid gland, and we will just represent it here. It will be important for a few minutes. So the parotid gland, and you know the parotid duct coming inside the mouth. So we will show also the superficial muscles. You know the muscle for the lips. We will represent too the elevator of the superior lip. This way. We will see these muscles on the dissection perhaps, and of course with the dissection film. The zygomaticus minor and the zygomaticus major coming in contact of the upper lip. We will find two muscles for the lower lip, the mental muscle, the depressor anguliparis, and the depressor labii inferior. And also, we have to draw the deepest muscle of the face, which is the buccinator muscle. So we have all the superficial elements of the face, but these elements are not very important for the surgery, of course. But what I'm going to represent now is more important. We have to draw the vessels, and the first one here is the facial artery. This artery is in close contact of the angle of the mandible, and it will go up to the orbit. is just in contact of the artery, we see the vein, the facial vein. Sometimes you have two veins this way. And you know, when you make surgery in this area, perhaps to harvest bone in this place, you are protected from these vessels all the time if you are under the periosteum. But if you are over the periosteum, there is a risk to injure this artery. So you always have to be under the periosteum when you make this dissection to harvest some bone here. It is really important because if you injure this artery, of course there will be a bleeding, an important bleeding, and in contact of this vessel there is a small nerve coming from the parotid gland which is crossing laterally these vessels, and if you make the hemostasis here with a very big electrocoagulation, you know, you can cause a lesion of this nerve. And some process have been caused by this problem in France sometimes. So here are the superficial elements of the face. You just have to remember these elements for the anatomy this afternoon and for the dissection film that I will show you in 1 hour. So now we are going to come in close contact of the maxillary sinus with another drawing, and I will show you the vessels that are giving the vascularization of the lateral face of the sinus. So we will take, to begin, the same landmarks and represent the same elements as you will see. First of all, the vertical one, second, an horizontal one. We find the mastoid process, the temporomandibular joint, the occipital bone, the nasal fossa, the orbit, and all the maxilla. You remember that there is a little hole here, a meatus from the orbital pedicule. And this time we will not represent the entire mandible, but only the symphysis. So we will see this area, which is the infratemporal fossa, with the lateral pterygoid plate, the maxilla, and a little bit peribo. Here the medial plate of the pterygoid bone. So the mandible will be represented as a section in the symphysis area. There it is. And the hyoid bone, which is an important landmark for the vessels. Here the tongue, coming from the hyoid bone to the mandible. And I have to represent one muscle, the origin of one muscle, which is the lateral pterygoid. In most cases, there are two parts of this lateral pterygoid, and we can't represent the distal insertion of this muscle, which is, as you know, on the neck of the condyle. So it's not possible to represent it here. Let's see the vessels now. coming from the common carotid artery. So here it is. It will divide in two branches in contact in the area of the yoid bone. The internal carotid artery, which will be an artery for the brain, so it doesn't interest us, and the external carotid artery, which will be an artery for the face. So let's represent it with its final division in a temporal artery and a maxillary artery, which is going to in direction of the maxilla. This maxillary artery, we will not represent all the branches because there are 14. But we will represent only two branches. One of them is giving the infraorbital artery, and this one is going out of the maxilla, just passing through this foramen, this infraorbital foramen. And we will show superior and posterior alveolar artery, which is coming inside the maxilla this way, and which is coming inside this way. And you know that it has been described communication and anastomosis between these two arteries, which is called the alveolo-ontral artery. I'm going to write it down. In most cases, this anastomosis is located inside the bone, or sometimes between the bone and the sinus mucosa. When it is inside the bone, of course, if you make an opening, here to the maxillary sinus, you're obliged to cut it. In most cases, it is a very small artery, and there is no risk, no important risk. You will get a little bleeding, and if you make a little electrocoagulation, some pressure inside the bone, it will stop. So that's not a real anatomical limit, because you're obliged to pass this way, even if the artery is present. It has been shown too that there is another communication, another loop between these two arteries, which is a periosteal one. So it is located outside the bone in the periosteum, and if you make surgical access of this lateral face of the maxilla, you have to consider this artery, and the best way to avoid cutting it is to make the back cut. You have to back cut, of course, is to make the back cut in the canine area, because it is forward to this communication. It's better than doing it dorsally, because you can take the risk to cut it. It's not, if you cut it, it's not a big problem also. You have to make the hemostasis, but it is not necessary to cut it, so you can preserve it. So this is this vascular network on the lateral face of the maxilla, and the most important element is the alveolo-ontral artery. You will see it on slides on the film, and I hope this afternoon in the section. So let's make now a section of this area, an horizontal section, represent the element on the upper side. We represent one above. So we have the maxilla. Here it is the nasal fossa. Behind the maxilla you have the pterygoid process. Here the maxillary sinus, its size is variable, as we will see. The lateral base is very thin, this way. And dorsally you will represent the mandible. Here the coronary process, which is sectioned, and here the condyle. So let's represent the muscles. You can draw here the masseter coming from the root of the zygomatic arch. Here the temporal, which is inserted on the coronary process, and here the medial pterygoid inserted in the pterygoid fossa, between the two plates of the pterygoid process. Here is the lateral pterygoid from the lateral plate to the condylar neck, this way. And here it's possible to represent the maxillary, the maxillary artery. This way. So here is the external carotid. Here the maxillary artery, which is coming across the lateral pterygoid, which is ending in the maxilla. And you will see, sometimes you can see that on the CT scan, on horizontal section of the CT scan, you can see that there is a little hole at this side, which is the location of for the artery to come inside the maxilla. And we will now follow this artery, which is at the beginning inside the bone, and when it is coming ventrally, it will become between the bone and the sinus mucosa. So when you make the assess of the maxilla, when you make the elevation of the mucosa, in this case, it will be possible to pull the artery with the sinus mucosa. I'm going to show the sinus mucosa this way. You know, it can be very large or very thin, it depends. And in this case, it is possible to assess the sinus pulling the mucosa. You also have to consider, if you see here the flow of the sinus, that in some case you will find some septas. I'm going to just show you two by example. And with the preoperative CT scan, you also have to consider these septas, because the elevation of the mucosa is very difficult to process in the area of the septa, of course. And it's better to decide to make the elevation forward or backward, but not exactly in the location of the sector. We will see that later. So, I propose to you, because we are not too much, I propose to you that if you have questions, you can stop me and ask a question, and you can make communication this way directly. So now I'm going to show you the inferior face of this area. I'm going to show you the palate on the next drawing. So here are the vertical line, as usual. Here the alveolar crest. The palatal bone. And here we will show two holes. The nasopalatal pedicule, and it will give the nasopalatine artery, you know it, of course. It will give the vascularization of the anterior region of the maxilla, the palate, and here the great palatine pedicule with the great palatal artery coming this way and giving a lot of branches, sometimes in very close contact of the alveolar crest. So, of course, if you only put implants on the crest, there is no risk if the access is good to injure these vessels. But we will see that for some very special procedures as pterygoid implants, sometimes there can be a problem with this vessel, with this very rare procedure. In an anatomic point of view, just remember that these two vessels are connected. There is an anastomosis between these two elements. That's why if you make a section of this nasopalatine pedicule, there is no problem for the vascularization of the entire mucosa of the palate. When we do the fourth one, osteotomy, in all cases we make a section of this pedicule, and there is never a problem with the vascularization of the mucosa. So if you are absolutely obliged to put an implant in this area, and if you have to, if you decide to put bone or bone substitute in this nasopalatine foramen, it is possible. There is no issue. We also have nerves coming from this area, the nasopalatine nerve, of course, which is participating to the sensitive innervation of the mucosal palate, and a great palatal nerve as well, which is giving the sensitive innervation of the posterior region of the palate. So really complete. And it is funny, most of you know very well the parodontology. You know it better than I am. So. And it is quite funny, and that in most cases the place that parodontologists have chosen to harvest the mucosa is this region. And on this drawing, you understand that perhaps it is the worst region in an anatomical point of view to take the mucosa, because it is a very rich region for its vascularization, and it explains that when you, of course you make the hemostasis as you can, when you have removed the mucosa, but it explains that in some case there is bleeding 4 or 5 days after the harvest, because the vessels start to bleed.
Up here you have the best quality of tissues.
Yes.
This is why you
I suppose it is the reason why you have chosen this place. But,
the most closer for of the gingival.
Okay, okay. Well, so just to finish with the maxilla, I'm going to show you a vertical frontal section of the face to sum up all these elements: the vascularization, the mucosa, and to give a little word about the buccal fat pad. So this time it is frontal section. I'm going to draw the nasal septum. This way. We will represent the superficial limit of the nasal fossa. Here, the orbit. And under the orbit, the maxillary sinus. So in this place, you have to consider the existence of ethmoid sinus with small cells. Space. You have the lateral aspect of the nasal fossa, the nasal concha, superior nasal concha, median nasal concha, and here an inferior nasal concha. We know of the entire face this way. The first element is to remember where the vessels are located. Here the infraorbital artery, here the alveolo-ontral artery, you remember it. Here the periosteal anastomosis. We will find here the mucosa, just between mucosa of the teeth, of the cheek. And you remember that there is a buccinator muscle just located here, this way. And lateral to this buccinator, in close contact with the lateral face of the maxilla, there is the buccal fat pad. I will show you that it can be useful sometimes. The first element we have to show is the nasal mucosa. And I want to show you that the nasal mucosa is the same mucosa that the sinus one. It is the same epithelium, and there is no difference between these two elements. No, they are continued. And that is explaining that in sometimes when we have a rhinitis, an infection of the nasal cavity, we also have an infection of the nasal sinus. That's why you have to check the sinus mucosa before making a sinus lift. Sometimes some people have a very long history of nostril and sinus infection, chronic infection, and sometimes it can be a good element for you because the mucosa is very large in these cases. So it will be very secure for you to make the elevation of the mucosa. But sometimes you can have people having acute infection of the sinus, and of course, in these cases, it is a contraindication of making the elevation of the mucosa. Sometimes also you can have polyps of the sinus, and this is just the traduction of a difficulty of ventilation of the sinus. And it's not a contraindication of making sinus elevation. It is very, very often present in the population. But if there is a very important problem of ventilation, sometimes it is important to show it to an otorhinolaryngologist for him to open this communication, this meatus of the sinus that you will show in the dissection here. Why the buccal fat pad can be an important element to consider? Because in some case, when there is communication between the maxillary sinus and the oral cavity, this way, it can be used to close this communication. It's very easy to make an incision here and to take this buccal fat pad to make the closure of the sinus. In most cases, the indication is when there is an avulsion of the molar, and because of this traumatism, there is a communication. But sometimes, if you have difficulties to close the sinus after harvesting bone or after an elevation of the mucosa, you also can use this buccal fat pad. So I will show you on the film too. So we are finished with the drawing for the maxilla. Do you have any questions about that? Wow. No question. Keep on. So we will now show the mandible. So first of all, a very simple drawing of the mandible showing the little place where it is possible to harvest bone, because it is our topic today. The mandible. The coronary process, of course. Mandibular body, and here a little crest, a little line, which is giving insertion to the buccinator muscle. I can show this insertion. So you also remember that there is in the angle the very important insertion of the masseter muscle. This way. There is a mantle foramen, of course. We will discuss about the form can have. And at the beginning, you know there are two types of harvests. You can take here the region of the synthesis this way. It is easier to assess, of course, because it's just in the anterior part of the mandible. It's very easy to assess. The main problem, is that very close to this synthesis, there are branches of the mental nerve. And these branches are very variable, they are very numerous. It is sometimes difficult to avoid all these branches when you make the incisions, when you track the elements to make this harvest. And you have to remember also that there is a little incisive nerve inside the bone, and you will be in close contact with it when you make this harvest. But it is a quite easy place to harvest bone. The other possibility is to harvest bone on the ramus. Now, at the beginning of the history of this bone harvested, they were made really in the ramus, in this place. But because of the insertion of the masseter, it was very difficult to make at this place. You have to pull the masseter. You have a very difficult access to this region. So actually, in most cases, the harvest is made in this area because it's really very accessible. It is possible if you make quite small harvesting. You can take a lot of bone, and you have to remember, I will show you that, that the more you anterior, the more the nerve is in close contact of the lateral face of the mandible. So the nerve is not very far in this region, but it is quite far of this lateral access here. You have to consider that. In very particular case, when you need a lot of bone and you have decided to harvest bone in the mouth, some people have proposed to take harvest in this place, which is quite difficult to assess too. You have to deal with the insertions of the temporal bone, which are located here. But it is also a possibility. Temporal bone. So here are the place where you can harvest bone in the mandible. Just an element about the mental foramen. When you make a simple optopontomogram, you can see that there are two types of foramen. Some of them are ovate, like this one, and some of them are circular. And you know that in some cases there is a loop that makes the inferior alveolar nerve inside the bone before going outside of the mandible, about this way. Of course, it's important to consider if you want to put an implant just before the mental foramen. is circular. It is circular. But when it is, when the foramen is obeyed, in most cases there is no problem. The nerve is going outside the bone directly. You know, it is exactly as if the nerve has to go backward before going out through a circular foramen. So we will see that. The most important place in the mandible in an anatomic point of view is the symphysis, of course. I'm going to show you an inferior aspect of the mandible. Here is the median line. Here is the mandible. And if you see an inferior aspect, you also see the urethra, the great horn, the body of the urethra. Here there is a muscle.